We good?
Mm-hmm.
Hey,
Yeah.
y'all. Okay, so hi, class. Hi, Dr. Marcy. Whoops, already I'm speeding ahead. So this is our presentation. We are Eric and Meg and Sunny and Amanda, and we worked really hard to create a really incredible mental health agency. It's called Sonder Mental Health. That's what we named it. We're not sure we needed to name it, but we did. So let's go to the next slide, agency description. So I will not read all of these words, apologize for the wordiness, but basically we created a program that is centered around schools. We'll start with an after school program. We'll also do outreach, like mobile outreach, going to homes and things like that. But basically we're working towards giving access to mental health services to all. That's kind of our reach, and you'll see that later in our vision. But we would like to provide care for basically we're working in Philadelphia, and you'll see that later as well. Some more things on that. But that's where we're starting. So please continue this presentation with me. So mission. I'll read this one because we like it. Our mission is to increase access to mental health services by addressing gaps in quality and affordability and related to mental health care access. Through social justice advocacy and diverse representation, we provide quality care that can be accessed by all. Our vision is, we're trying to be catchy here, a professional counselor in every home. And then our values. These are a couple of our values. We have more, but we'll stay with these: quality, accessible, relevant, affordable, accepting, holistic, and empowering. And then this is the type of agency and the state we're working in. We'll be working in Pennsylvania, like I mentioned, Philadelphia. We decided to be a for-profit LLC, limited liability corporation. So basically, we're going to stay with the for-profit situation, but still be kind of a social enterprise. And you'll learn about our pricing and insurance policies later. But in order to start our LLC, we found within Pennsylvania, there was a governmental website that was called One Stop Shop. And it gave us 8 steps to basically the basics of starting a business and what you go through. And it seemed like a very easy process and something I will plan to use personally. I know that everybody else felt like it was a great idea. So something we might use in the future. But here we are, Pennsylvania.
Yeah, thank you, Meg. So I'd like to talk about the service delivery that our agency is going to be providing. So we are basically focusing on expanding some mobile services and after school-based mental health programming. So we find that there's really a need for access to healthcare, which may result from, like not being able to go in places, not being able to like go to a clinic. So we wanted to make sure that we could outreach into the community where it was needed. And then for the school-based programming, will be mainly after school. And it will be focusing on situations that help clients learn coping skills, social and emotional learning. So just becoming, a little bit more aware of their emotions, resilience, and enforcing their self-concept.
Moving on towards like insurance. Obviously it'll be important for our company to obtain different type of insurances, as to protect the business, the organization, to protect the clients, and as well as to protect our employees. So there are several different types of insurances that we will obtain and also pursue in order to not only protect the organization, but to as well work with clients who can afford to who want to participate in the organization, which is, in other words, I'm saying insurance is like Medicaid. And so we, to protect the organization, or just to name a few, our company will have liability insurance, which will be designed to protect the clients. And we will also carry malpractice insurance to protect the employees. But when it comes to actually working with clients who have Medicaid, there's actually a process in which we have to take in order to be able to work with those type of clients. And the first part of that process is obtaining an MPI number, which is issued by healthcare providers to help send information electronically. In other words, moving forward from that, we will also have to register with the Medicaid as a participating provider in order to provide services, and be able to bill for Medicaid.
All right. So now we're going to jump into the many legal and ethical considerations that we have for our agency. So the first one that I'd like to talk about is HIPAA and high-tech requirements. So because we are going to be using electronic health records, we need to make sure that they're secured. So you'll hear later, we're going to be using therapy notes to, have our electronic health records secured. But also, like sometimes there's emails you have to send out that may have some confidential information about a patient. So we'll make sure that when our client or when our counselors are sending information that has HIPAA protected content, that will encrypt those emails when we send them out. And we will also be providing documentation for treatment planning. So we will be very upfront with the clients about, the type of treatment they'll be receiving, the payment, the healthcare operations, and disclosures related to mandated reporting and emergencies.
Legal and ethical consideration also rose into working with court-referred clients, and that's something that'll be extremely important because a lot of these court-referred clients also intend to feel like they're being coerced or forced into treatment. So it'll obviously be important to understand these clients through cultural competency and building rapport, to be able to effectively treat these clients and know how to treat these clients. And that also rose into collaborative efforts and being able to work with the court systems to make sure that these clients that are being referred is actually being treated for the right type of mental health that they obviously need to be treated for. To effectively implement a better quality of life.
And to touch on staff credentials, we're looking for a few different licensed professionals. The first are licensed professional counselors, licensed social workers, licensed marriage and family therapists, school counselors, which is basically an LPC with a concentration in school counseling, since we're focusing a lot on school programs, and also certified advanced alcohol and drug counselors. The reason that we're super focused on people having their credentials is by having clinicians on our staff with those credentials, it impacts the organization's ability to bill insurance companies in several different ways, depending on what services are being provided.
So to speak about some of the more specific codes that relate to some of the ethical issues that we have, the first is informed consent for participation in treatment from outpatient providers and for supervisor roles. So the patient understands, the information that they tell their counselor may be relayed to the supervisor, and may be relayed with outpatient providers to provide that continuity of care. And the other code that we identified were it involved the the involvement of support networks within the school system, because, you know, we're working with children and adolescents, and they have a pretty large support network, whether it be their family, their extended family, family friends. And so we want them to be able to be a part of the treatment if that is deemed clinically appropriate. So we'll make sure that if a support person or support network were to be involved in treatment, we would have the client sign requests of information, so that we can ensure proper communication with the support system. And they can also choose to, you know, say, okay, we can talk about all of this except for, you know, maybe this one thing, and kind of have it in a legal document, so we don't overstep our clients, overshare when they aren't comfortable with us sharing certain things. So thinking and kind of just going off of the electronic health records, we are going to be using therapy notes. So we liked therapy notes because it was kind of like a one-stop shop. It had electronic health records, it had reimbursement. So we wanted to include electronic health records because there was a study that's shown that the utilization of electronic health records can be very helpful with continuity of care, and just making sure that, you know, every time a client goes into a new space, they don't have to retell their story and, you know, go through all that rigmarole. They can just jump in and say, like, these are my presenting concerns.
And just to follow up with that, we're looking at using therapy notes for our third-party reimbursement as well, because they do billing. It helps with mistakes. Therapy notes basically talked about on their website about how they have a higher rate of successful filing with insurance and less rejections. So we would love to have that as part of our agency. We would like less rejections, so we're working with them for that.
Yeah. And so continuing on about electronic health records, this is actually the citation for the study that showed, you know, it improves communication between providers and treatment adherence, and we also see some improved health outcomes. So we thought it was important to have these electronic health records. And it's also important to note there is an ACA code B6B, and it states that counselors ensure that records and documents are kept in a medium that's secure and that only authorized people have access to it. So we'll have logins for each of our coworkers, our counselors, to make sure that, you know, we know who's accessing the documents. We have a paper trail if people, you know, access information that they shouldn't have, and we'll be able to follow up in the most appropriate way.
And speaking on fees for accessible services and billing, we're going to be using a sliding scale. So the formula that we're going to focus on is 0.001 times the annual income of the client to determine the cost of the session. And the ethics code that this follows is C6E, contributing to the public good. So basically, we're making a reasonable effort to provide services to the public for which there is no little or financial return.
Okay, so moving on towards community outreach and crisis response, because we can't have our staff out here not trained. So we want to focus on staff training and make sure our staff is very equipped, especially because they're going to be working with a lot of diverse and multicultural individuals, families, adolescents, kids, and in various in various environments, especially with everything going on right now in all, you know, in the world. I think it'd be very important to have our staff trained in crisis and counseling crisis prevention, excuse me. And so with doing so, we're gonna implement or acquire training from assistant programs such as the Crisis Counseling Assistant and Training Program, which will aid our clients and be able to help them and give them the tools and skills necessary to go out into these communities and go out into these homes and schools and be able to properly respond to a crisis situation through crisis intervention, cognitive behavioral therapy, and just equip them with the necessary tools they need to be able to handle any situations or handle a lot of situations that they end up involved in.
We also choose to use text-based counseling specifically because our clientele is a lot of young people, and there's been studies showing that it's shown significant reach with them. It can be really intimidating to talk to someone face to face, even if it's over Zoom, for example. So offering that to let them just kind of send a text like, hey, I'm having a bad day, or in crisis situations, it can be the quickest way to get a hold of someone if we can't be in multiple places at once, if there's a large group of people that need assistance. So that's why we chose to use text-based counseling for our community and crisis.
And within our agency, of course, there's going to be crises or perceived crises that may happen. So we need to have an internal crisis plan. So we're going to make sure that we train staff on a code system. So we'll create codes for, if kids run away, they get too dysregulated, for elopement, medical, basic medical things, an active shooter, which is very prevalent. We want to make sure that we are prepared for that. And also, fires and evacuation protocols. And after a crisis event, we want to also provide counseling for not only the clients, because we're going to have to be there to support them, but getting counseling for staff who may have experienced a traumatic event during work or outside of work. We want to be there for our employees and really, show them the type of care that we want to show the community. So we're going to be working with multiple different agencies. So one of the first local agencies that we wanted to connect with was the Philadelphia Office of Community Empowerment and Opportunity, or CEO. So we're going to be working with CEO. What they do is basically they work on legislation and events that empower and just make services more accessible, and that goes for even like just healthcare, getting financial, food stamps, things like that, so we can connect with some of the more lower income families with services that will help enable them to afford our care, live better, be able to eat, have all of the things that they need to get them in the place where they need to be. And really advocating for those low-income families so that they can receive mental health benefits, because that can be a really big barrier for some.
The next local agency is the William Way LGBTQ Community Center. Their mission and vision statement is about supporting and empowering the LGBT plus community in the greater Philadelphia area. The reason we chose them and to partner with them is to be a clinical counseling resource. They don't have licensed therapists in their center. So what we can do is step in that aspect, and we can work with their peer counselors that aren't licensed, but they're trained in some aspect as a clinical team to assist in cases that a licensed therapist will need to step in. And the same also goes for recovery meetings. Having a counselor there for more clinical knowledge is something we can provide while also receiving education from them about the LGBT community.
And speaking with collaborating with advocacy programs, we also will be planning to team up and collaborate with organizations at a national level, federal level, involving the President's new Freedom Commission on Mental Health, which involves the Department of Health and Human Services and the Institute of Medicine. And which is a fun fact, at the start of the pandemic in 2019, President Biden actually donated $300 million to public health. And that fact is backed up because according to the Center of Mental Health, in schools, between 12 and 22% of kids in school are having mental health issues. And in addition to that, a study done by the U.S. Department of Health and Human Services Offices of Adolescents Health suggests that kids in school setting prefer to have counseling-based programs because they often feel a lot more comfortable opening up about some of the traumatic or just having a counseling intervention, some type of intervention that is counseling based going on because they spend so much of their time at school. So to conclude this project, we hope we found this very informative. Our agency will probably be the latest, and we thank you guys for participating in this PowerPoint. Thank you guys so much.
And here are our references. Thank you so much.
Bye.
Okay.
Is it done?
All right,
No,
stop.